Welcome back to the second part of the mood disorders. So classes of antidepressants where we left last time: tricyclic antidepressants, selective serotonin reuptake inhibitors SSRIs, serotonin norepinephrine reuptake inhibitors SNRIs, and monoamine oxidase inhibitors MAO-IS, and atypical antidepressants. Let's study about one by one. So tricyclic antidepressants, also called as TCAs, their action is to inhibit the reuptake of norepinephrine and serotonin into presynaptic nerve terminals, and their primary use is to control the major depression. The examples include the imipramine, tofranil, and clomipramine. These are the names of the drugs which are used as the action of the antidepressant. So when we talk about the therapeutic mechanism of the TCAs, at the low therapeutic dose or at the beginning of the toxicity, the TCAs, they inhibit neuronal reuptake and catecholamines, especially the norepinephrine. 5-HT, so increase their level in the synapse. So what happens? They usually inhibits the neuronal uptake, reuptake of two things. One is the norepinephrine and the other one is the 5-HT, which is also called as the serotonin reuptake, norepinephrine and 5-HT. So they increase their levels in the synapse. Now what happened in here, they are showing us in the norepinephrine synapse, there is a transmitting presynaptic neuron. In this presynaptic neuron, you can see reuptake sites at the corners down, or these are also called as the transporters, and the underneath, it's a postsynaptic neuron, which are the receivers. And on the postsynaptic neuron, there is the neurotransmitter receptors. So this is all our synaptic cleft. In this, we can see there is a more of the serotonin now, and that's why we are reuptaking that. So norepinephrine and serotonin, they are normally removed from the synapse by the reuptake sites. So these reuptake sites, they take all this norepinephrine and extra serotonin, which is in the synaptic cleft here. And so tricyclic antidepressants, what they do? They block the norepinephrine and the serotonin reuptake sites, allowing these neurotransmitters to remain active in the synapse for the long time. So that is the main mechanism of the action for this one. Then if we talk about the adverse effects of the TCAs, it includes orthostatic hypotension, sedation, dry mouth, constipation, urinary retention, blurred vision, and tachycardia. And some of them we can remember with an easy mnemonics, which is tricyclic antidepressant, and its name is TCA. So we remember with T as a tachycardia, C as a cardiac effects increase, it increases the arrhythmias or the QTC. It shows the anticholinergic effects like the dry mouth, the constipation. Then is the S for the sexual dysfunction or the sedation. So easy way to remember the TCA side effect. These are the more common ones. Then comes to selective serotonin reuptake inhibitors, which is SSRIs. Their action includes, they also slow, but the reuptake of serotonin only. That's what the name is. So they are selectively inhibiting the serotonin reuptake into the presynaptic nerve terminals, postsynaptic receptors, and become more sensitive. Their primary use is to relieve the depression, and their examples are fluoxetine, which is Prozac as a brand name, paroxetine as a Paxil as a brand name. Now here is the effect of the SSRI on the somatodendritic region. If we see in this picture here, before the SSRI is attacking there, so we have this all dendrite, which is a before SSRI. We can see these yellow things, these are the SSRIs. But after the SSRI, which causes the increase in the somatodendritic area of the serotonin neuron and downregulation of 5-HT, which is also called as serotonin 1A autoreceptors. So that's how their amount increases in the somatodendritic region. So they also have the adverse effects like the TCAs, the SSRIs, they also have their adverse effects. They decrease the libido and they reduce the ability to reach the orgasm. Men, it causes the delayed ejaculation and impotence also. Nausea is for everyone, headache is for everyone, and anxiety, insomnia is for everybody. Another easy way to remember the SSRI side effects is we say BAD, bad SSRI. So B stands for body weight increase, A stands for anxiety and aggression, and it may need to mitigate the antidepressant-induced anxiety with benzodiazepine drugs for 2 to 4 weeks. D is for dizziness. S is the side effect as the sedation. Another S is for stimulated. CNS is stimulated, so it's showing your sympathetic nervous system effect. R is for reproductive or the sexual dysfunctioning occurs, and I is for the insomnia. Other than that, we also have another SSRI side effects like S, and S, stomach upset, sexual dysfunction, and one of the other things is called a serotonin syndrome with also other serotonergic agents. It means if you will be taking the serotonin SSRI drug with any other drug, it should not be taken. It has a drug-drug interaction which causes the serotonergic agents. So the drugs which are effective for sadness, panic, and compulsions, these drugs. They're effective citalopram for like E for effective, E for escitalopram. This is an SSRI. F for fluoxetine, fluvoxamine. S for sadness, S for sertraline. P for panic, P for paroxetine. And compulsion, C for compulsion, C for citalopram. So if you remember a mnemonic, effective for sadness, panic, and compulsion, so the first letter will tell you what are its side effects. Easy way to remember. Now then they are telling you the serotonin syndrome that we learned, SES, this may occur when the SSRI is taken with an MAOI, that is MAO inhibitor or tricyclic antidepressant or lithium. So a person, if he is taking SSRI for a depression disorder, they should not be taking MAO inhibitors, TCA, or lithium along with them. They affect the metabolism, synthesis, and the reuptake of the serotonin. That's why we do not take it. And the symptoms include changes in the mental status, hypertension occurs, which is the high blood pressure, tremors occurs, sweating, fever, or the lack of the muscular coordination occurs. Now let's talk about a little more of the serotonin syndrome. It is a condition that occurs when there is too much of the neurotransmitter serotonin in the body. Symptoms includes a person who is showing the serotonin syndrome, what happens to him? It has a change in the mental state, it has a dry mouth, it complains of sweating or fever, hypothermia sometimes also, or shock, diarrhea or nausea occurs, tremors or reflex changes occurs, muscle rigidity occurs, and they can complain of that they're mixing the meds. Now, how to remember the side effects of the serotonin syndrome? One more mnemonic, which is called as shivers. So for the shivers, S is shivering, H is for hyperflexia or myoclonus, I is for increased temperature of the body, V for vital signs instability, like heart rate increases, rhythm increases, and the blood pressure decreases sometimes. E for encephalopathy, and R for restlessness, and S for sweating. Again, one easy way to remember what are the symptoms of the serotonin syndrome. Then closer to that, it is a SNRI. Instead of SS, it's SN. N means norepinephrine. But the same thing, in this one, we are doing the inhibition of the norepinephrine. So they inhibit the reuptake of both serotonin and norepinephrine. They affect the same neurotransmitters as the TCAs. For example, the drugs are desvenlafaxine, duloxetine, and venlafaxine, but they also have a less adverse effects than the tricyclic antidepressants, that they causes liver toxicity and the lower scissor threshold. Then is the next class, monoamine oxidase inhibitors, MAO inhibitors. Their action is they inhibit the monoamine oxidase, norepinephrine, dopamine, serotonin in CNS, not broken down, intensify neurotransmissions and decrease the symptoms of depression as well. And their primary use is when the other antidepressants are not effective, only then we give the MAO inhibitors to the patient. Now, how the MAO inhibitors, they affect on the serotonin. If you see the MAO inhibitor, the capsule MAO-A, it breaks down the serotonin, it's breaking down the serotonin, and then synthesis is occurring. Serotonin is produced directly in the neuron. Then storage occurs. VMAT transports the serotonin into the vesicles. Then these vesicles, they will release, number 3, vesicles releases the serotonin into the synaptic cleft. And in the synaptic cleft, now a reuptake pump occurs when some serotonin is naturally reabsorbed through the reuptake. So what is MAO-A doing? The MAO-A inhibition prevents the breakdown of the serotonin, allowing for increased serotonin concentration. So there will be no breakdown, there will be no release, there will be not so many of the serotonin into the synapse, and the problem will be solved. The mnemonics to remember the monoamine oxidase inhibitor side effects is HAHA, HAHA. H for hypotension, orthostatic, A for anticholinergic side effects, H for hypertensive crisis, avoid tyramine, and then anxiety, A for anxiety, A for agitation, and A for anorexia. It also causes one of the side effects, which is called as hypertensive crisis, which occurs when the MAO inhibitors is used with other antidepressants, sympathomimetics, or any food which contains the tyramine in it. The symptoms of the hypertensive crisis includes occipital headache, like the back of the head is you're having a pain, stiff neck, flushing, palpitations, profuse sweating, or nausea. So hypertensive crisis, it is an umbrella term used to describe the two conditions that occur due to extremely high blood pressure levels. And hypertensive crisis causes two things. One is hypertensive urgency, one is hypertensive emergency. Urgency means when your blood pressure spikes to 180 to 110 or higher, but no organ damage. But when it becomes hypertensive emergency, the blood pressure shoots to the 180, 110 or more, organ damage occurs like heart failure, stroke, chest pain, heart attack, or aneurysm can occur. Then we studied about the foods containing the tyramine. So the fruits like avocados, bananas, raisins, papaya products, including meat, tenderizers, canned figs. Dairy products include cheese, except only the cottage cheese. Everything else have the tyramine in them. Sour cream, yogurt. In alcohol, the beer has the tyramine, wines, especially the red wine and Chianti. Meats, beef or chicken, meat extracts, pickled or kept herrings, pepperoni, sausage, bologna, hot dog. And in vegetables, the pods of the broad beans, fava beans, in the sauces, the soya sauce, the yeast, all yeasts or yeast extracts, and the chocolates. All these foods are not allowed to eat when you are taking the MAO inhibitor drugs, or because they all have a tyramine in them and we should not be taking the tyramine. If you take this food with the MAO inhibitors, it causes the either hypertensive crisis or the serotonin syndrome occurs when you take the MAO inhibitors with any of the other drugs. So this is how the tyramine reacts in the body. Tyramine in the gut, tyramine metabolism by the MAO-A inhibitor and MAO-B inhibitor in the small intestine, and it is by the A and B in the liver. So it acts in both of the bodies. When there is an increased tyramine in the blood circulation involved, then the tyramine metabolism by the endothelial MAO-A increases. So when we take the tyramine-rich food, it increases the MAO-A in the body. And that MAO-A oxidase converts into a noradrenaline into their metabolism. So the same MAO inhibitors oxidase converts the dopamine into metabolites, and what happens at the last? MAO inhibitors inhibit the peripheral catabolism of the tyramine, allowing the tyramine to enter the systemic circulation, and they enhance the noradrenaline release through the actions at the DAAR. Now is the next class, atypical antidepressants. Their action is they inhibit the reuptake of serotonin and affect the activity of the norepinephrine and dopamine. One more neurotransmitter is added up here, which play an active role in the mood stability. The primary use is for the depression, and the examples includes bupropion, Wellbutrin, and nifazodone, which is Serzone. So after this, we will continue the chapter in the next video. Thank you.